Mona.
Has joined.
The evolving COVID-19 situation has created unprecedented challenges for all of us. Tonight's topic is practice and deployments. In order to successfully moderate this meetup, we have muted all audio, and during the open forum portion of our agenda, you are able to unmute your own line. You are also encouraged to use the chat box at the right of the screen to post your comments and questions. Please indicate if your question is directed to a specific person on the call. Please take a few moments to review the ground rules for the meetup. We have close to 60 members calling in tonight from a variety of practice areas and in many different settings, inside and outside of AHS. This call will be moderated by Robin Scott, President of SAOT, and Rosanna Wagner, Chair of our Professional Affairs Committee. During the last few minutes of the call, we will have a self-compassion exercise. I would now like to ask Robin Scott to introduce our guests.
Good evening, everybody, and welcome, and thanks for coming back. If this is your second time participating, and welcome to those of you that are here today to discuss what it looks like right now as an occupational therapist, what our scope of practice looks like, as well as what it may look like for deployments in the future. Today on our call, we have guests Marianne Baird, the registrar with ACOT, who's here to answer questions from a college's perspective, as well as Carmen Lazarak, who is the provincial practice lead for occupational therapists across the province for AHS. First, I'd like to just check in with Marianne and ask if there's any updates that since the last session that we had together, Marianne, from ACOT, or anything you'd like to share.
Not specific to since the last session, but just more to the general topic tonight in terms of scope of practice.
Megan Taylor has joined.
So for occupational therapists, and in fact for all health professions that are governed under the Health Professions Act, they don't specify a scope of practice per se. They look at use of title as what is restricted, and then restricted activities, and then the activities that you're allowed to do. And that's what defines our scope in a term. They stayed away from scope of practice language in the Health Professions Act because they wanted, when it was written back in the 2000s, they wanted to really have more flexibility between the professions on what professions could do. So really, when it comes to the question of what could my employer ask me to do, it really comes down to any restricted or unrestricted activity that you're competent to do or that you get training to be competent to do. And with that, I'll hand it back over to you.
All right. Thanks, Marianne. And then Carmen, are there any components that you would like to start off by just sharing before we open up to the general forum for questions and sharing?
Yeah, thank you. And Robin, did you want me to speak a little bit about redeployment and kind of what's happening right now?
That would be really
provincial
helpful.
work.
Yeah, I think there's been lots of questions about that from within AHS. I'm sure for some of the folks that are out in school health, although we may not from an AHS perspective be able to comment on those pieces, I think it would still be useful to gather some of that information from you.
Yeah, absolutely. And I'll speak very generally, not obviously there's different activities happening with different program areas, so I'll just keep it very broad. And first of all, in follow-up to our last session a couple weeks ago, for those of you that were on the line, I was mentioning to a SharePoint site for allied health. I did unfortunately confirm afterward that the SharePoint site is currently only open and available for anyone with an AHS email, some Covenant staff and AHS staff only at this time. However, if there are particular documents or supports that you need, and if I'm aware that we've created something within AHS, I can certainly look into and confirm whether I could share that with external to AHS OTs as well. But the SharePoint site itself is unfortunately not open to, it's just the way it's built, I think. Otherwise it might be, because it's not a web page. So that's in follow-up to our last session. And today I wanted to just give an overview. We've created a document that's really targeted for operational leaders and allied health leaders within AHS. So it is fairly broad, and it's really outlining the skills. There's a table basically that goes through what are the skills of an occupational therapist, and all of the allied health disciplines have their individual tables that really outlines sort of what we expect the skills to be during the pandemic that would be most sort of needed from occupational therapy. And then there's also a subsequent sort of supporting table that go through the additional skills that OTs could be easily trained in, or depending on their practice area, might be able to just jump right in and do. These are skills that are not necessarily typically part of an OT's role, but where with redeployment, those staff could certainly be asked to do to support patients and families in certain ways. So these include things like basic care, comfort care, actually feeding patients, so not therapeutic feeding, but actual just feeding patients. Things like, discharge planning that we would normally do within our roles, but maybe to be kind of more involved in the clerical or administrative part of that, psychosocial supports for patients and families, some pandemic specific tasks such as supporting HealthLink or other advice lines, doing staff and visitor wellness checks, screening and triage, patient and family and caregiver education. So I'm just kind of scrolling down here, as well as some other things like, lifts and transfers and mobilization that obviously we do within our roles, but we've sort of tried to put together a table across all the disciplines outlining what somebody trained to do. So for example, an audiologist not necessarily consider themselves skilled to do that and would train to do that, whereas for other disciplines, it's part of our skills. So this is really meant to, again, support leaders in making decisions when they have staff that are being redeployed, as a quick sort of checklist of what skills we can expect each discipline to be able to either do right off the top or with some additional training. And our next step of this work is to start to identify what training is available provincially within each of these skill areas, so that, again, leaders can understand how much time someone might need to be able to prepare for and start in their work when being redeployed.
And Carmen, I'm just seeing a comment from Taylor asking if you would be able to share that document. Taylor says that it sounds like a great tool to communicate with management about what areas we could best support and help in.
Yeah, definitely. And is Taylor with AHS? Taylor, I'll get you to email me directly at carmen.lazarick@ah. Oh, okay. Just email me anyways, carmen.lazarick@ahs.ca, and I can follow up with you. And yeah, in long-term care, absolutely. We're definitely thinking about long-term care settings for this work, and obviously for redeployment. And I can also just mention that we're actually planning to pull together some OTs across the province to start some conversation around redeployment to long-term care as sort of I think an area of need, and it probably will be quite informal, more of like a community of practice, or just an opportunity to come together and talk about what that redeployment practice is looking like, and hopefully how we can really support OTs to go into long-term care and be able to take on the more traditional roles of an occupational therapist, even when being redeployed. So rather than assuming that they're going to take on sort of an assistant lead, it would be more that we want them to be able to work to their full scope and identify their own competency needs and training needs to be able to work. So we'd love to reach out with OTs working in long-term care to support that action as well.
Thanks, Carmen. That sounds really interesting. I'm curious to see how those conversations unfold and what the next steps might be. So at this time, I'd like to open up the forum to questions from participants out in our communities. If there's questions specifically for Marianne, for Carmen, for SAOT, we'll do our best to answer them. So at this time, we have folks that are muted. You can unmute yourself on your phone or on your computer. You can also use the chat box area to post your questions, and myself and Rosanna will try and keep track of all that. I'll also invite folks, maybe if there's anybody on the call today that has experienced redeployment, to share your experiences, share your insights, feedback in general about what's working for you.
Laura here has mentioned that she was really looking forward to the SharePoint for resources from Carmen. Is there any chance at all that this will open up to non-AHS employees, Carmen?
Yeah, so I double checked with a couple different people just to see what the options are. And at this time, it doesn't sound like there is a plan to be able to open up that SharePoint site. However, things are changing very, very rapidly. And especially around the SharePoint site, there's been sort of a team of people looking at how we can best organize the tiles and like we've now got filters on it, so you can filter by your discipline and find all the documents, that because it's growing and becoming fairly large, lots of different resources there. So I will follow up, and I can get back to Robin directly and the SAOT leads here to update if that does change. Yeah, we'd certainly want to make them available whenever appropriate. So I'd love to make that happen, and I'll definitely keep advocating for that. There's also a chance that we'll be moving these resources and really the whole SharePoint site to an insight page, which also might allow us to then identify which resources are appropriate for sharing on an external facing website, which would then give you access that way as well. So I'll definitely keep you posted, maybe by next week, or at least by emailing Robin and the leads for today's session.
Thank you, Carmen.
Great idea. Carmen, this is Rosanna, and I actually do have a question for you when you mentioned with regards to supporting more long-term care centers. Do you know whether if there is a kind of move to maybe redeploy some AHS employees into more private long-term care centers, or is it more kind of general OTs in the community or in Alberta?
Yeah, I haven't seen our CEO's update from tonight yet, so maybe there might even be changes happening right now. But I certainly do think that that's one possible direction. I know a lot of people are still in limbo, kind of waiting for redeployment, but I certainly have heard of sort of that need, and definitely that their leadership is looking at where we can support in long-term care.
Carmen, it's Robin here. Robin with an I. Just wondering, obviously everyone's looking at the numbers of COVID patients around Alberta, and Calgary has significantly more numbers than, let's say, Edmonton or in the north or in the south. So how would you comment relative to what the impacts have been on OT in Calgary versus in Edmonton?
Mm-hmm. Yeah, and I don't know the scientific background. I know that what I've heard in the media and from our reports from the CEO, that it's partially related to the fact that we've done more testing here. So when they were implementing the more rapid testing procedures, they started with the pilot, or the initial phase of that was in Calgary. So our number of tests did go up faster in Calgary than in other areas of the province. But that doesn't explain the increased number of actual deaths from COVID as well. So I think that it has to do with some of the long-term care centers and the spread that occurred. And I know that they're definitely looking at resourcing according to the numbers. So they're talking about the needs based on those cases and where the higher volumes are. And I haven't heard this, but I've also just myself been thinking about that there could potentially be more strict sort of community rules within Calgary because of the increased risk in this area. But I leave it to the experts to make those decisions. So that's all I know at this point, Robin.
Thank you. And Rosanna, looks like we have a question from, looks like Charlene.
Yeah, so this is an area that I'm not familiar with at all, but Charlene is wondering whether if we should be offering chest percussion like we do for CPD patients for mild cases.
Is that, you guys want me to try
I'm
to
not
answer
sure.
that?
Yeah, that'd be great, Carmen, if you can.
Yeah, no, I won't be able to directly because I don't know. I know that we have an ICU huddle that's happening on Tuesdays and Fridays, and we're inviting both physiotherapists and occupational therapists to attend those huddle sessions. Initially, it started as a physiotherapy huddle, and we've decided that rather than holding a separate huddle for best practice related conversations separately for OT, that we would just join physiotherapy. So that's a really great place to take questions about specifically about critical care and the what is appropriate in terms of treatment. I do know from speaking to Stephen Siebold and his colleagues that there's certainly some risks associated with any kind of mobilization, chest physiotherapy, that type of treatment early on, and that these patients with COVID are very acute and are really changing rapidly, so they can be feeling not too badly, and you appear to be able to do some mobilization, and then their SATs can really change very quickly. So again, I'm not the expert, but I know that there's lots of data starting to be collected and research that we're reviewing about what exactly the research is showing and what treatment we should be providing. And in some cases, physiotherapy and occupational therapy won't be going into those critical care rooms and doing treatment, active treatment with those patients if they're not stable enough. And so I think one important thing for us to keep in mind is just really connecting with the physician and nursing colleagues on the team and really taking a team approach to decide whether proning or chest physiotherapy or mobilization, cognitive mobilization, what is appropriate for each individual case. And you're asking about mild cases. So again, I don't know exactly, Charlene. I think we'd have to, take that offline and have some, unless someone else online wants to try to answer, Charlene, that might know more than I do.
So not hearing anybody.
Anybody on? Oh, go ahead, Robin.
Oh, I was just going to say, if we're not hearing anyone right now with other answers or other feedback on that, I'm thinking, Charlene, it would be helpful to maybe have some more conversations offline, like Carmen mentioned. And then we can gather more information and maybe share that once we have a little bit more knowledge.
Perhaps we can maybe start off by, go ahead, Robin.
It's Robin with an I again. I'm just wondering, Carmen, in general, what role OTs are taking in the area of mental health right now. I'm assuming there's really an increased need.
Yeah, there absolutely is. So I know that again, in local settings and in certain programs, there's absolutely lots of work happening, and OTs are not only finding that there's a increased demand for mental health support with their clients and families, but also with their colleagues. A lot of occupational therapy practice leads and frontline and managers, OTs across the board are really finding that they're needing to support their teams through these difficult times. So one thing we've been talking about provincially, and actually someone from the Edmonton zone sort of asked what role our provincial team might take in supporting across the province, supporting staff in their mental health needs during this time and just dealing with increased stress levels and anxiety. And so we've taken that forward, and my colleagues for social work and psychology practice leadership across the province have already had some meetings, and we're going to be talking about what role might actually play in addressing those needs. And so one of the things we're asking for is to identify exactly what those needs look like and in what pockets or populations, and if it's staff, who is it, etc. I also know that the Addiction Mental Health provincial portfolio, and as well as the Strategic Clinical Network, are really actively involved in looking at what the addiction mental health needs are. Certainly the addiction mental health lines and services have experienced increased volume. So we know that people are reaching out and requiring more services at this time. And then I guess from a kind of core rehabilitation lens, we are also talking about the need for those teams to almost sort of shift their practice a bit and provide more of that mental health support. And lots of teams are already doing this, where they're calling clients and following up with them. And even when they can't provide a one-to-one service, or maybe to work on upper extremity or mobility or cognition or whatever it might have been that their treatment plan entailed, is to really follow up with them from a more of a mental health perspective and just see how they're coping and checking in with them and really providing those check-in phone calls. So we're looking at whether we could provide some guidance around that to support teams and programs to continue doing that during the pandemic, knowing that the demand on like the call-in centers and whatnot are so huge right now. It
That's
certainly
great,
has been
Robin.
identified as a huge need.
For sure. This is Rosanna here, and I kind of help to support 2 OT community programs, and that's what we're planning on doing, is actually going through our wait list and doing a kind of wellness check on all of our clients to see if there's anything that we can support them at this time, provide them with resources, or even just to listen to them, because we know that some of these clients don't have anybody to actually connect with and have that support. And so if we can have a resource like that to be consistent, that would be amazing.
Oh, that's wonderful that you're doing that. And yeah, we're actually, there's briefing notes and whatnot going up to the ECC, so kind of the senior leadership team responsible for the emergency response, the pandemic response. We are, as a team, trying to bring up all of these issues that we're hearing from all of you guys, and making sure that our senior leadership are really, really aware and giving them specific examples of where these issues are coming up, what zones, or is it all zones, or with what disciplines, across all disciplines, etc. Really giving that context so that they can be aware and approve requests for either whether it be funding or just operational leadership needed to make certain things happen. So I think I mentioned last time the idea of providing more rehabilitation advice virtually, and we know that there's lots of virtual practice happening right now, but wanting to kind of coordinate and really operationalize that need for virtual practice, so that, like you guys are doing right now, you're calling the people on your caseload. But I've also heard from many different programs that there's a huge backlog of referrals that is occurring, and we don't know when and how we will then address those backlogs of referrals. So we need some proactive approaches to be able to actually reach out to people and provide services in the meantime, and not just have them sit on a wait list. So yeah, thank you for bringing forward, Rosanna, your team, and everyone across the province has really been, making your needs known. And I really encourage you to keep doing that, because it's through hearing your suggestions and what your needs are that we can really advocate for change provincially and get the support we need.
Speaking about with regards to like shifting directions, is anybody on the call that's currently, pre, semi, or fully deployed and would like to share their experiences? I guess I'll share mine. It's Rosanna here again, and part of our teams, we're currently being trained to be redeployed for swabbing at assessment centers and primarily in drive-through assessment sites. And it is definitely a challenge with regards to the training and doing the buddy shifts and doing all of the modules. But once we find, what I've heard from some of my colleagues who've done the modules and also the buddy shifts, it's kind of, you do a half day of modules from the training to learn the information about the swabs, and then we do a 2-hour buddy shift from a nurse or an RT who's done the swabbing, and we practice kind of the PPE. It's repetitive, and you just kind of learn the paces. Overall, it's been a very, very positive experience from all of our colleagues. Initially, I think there was a lot of anxiety and a lot of kind of fear about what's going to happen, the unknown, what if I get sick too, if I'm exposed and whatnot. But I think after that buddy shift, most of my colleagues are asking for shifts right away because they almost feel safer that they are fully gowned and there are measures to protect them. And so that is the experience from our teams. We are currently, semi-deployed with some team members that are being asked to take on a shift or two. We are not fully deployed at this time. Anybody else? Or perhaps does anybody have any challenges or anxieties and or fears with regards to redeployment or questions in general?
Rosanna, it's Robin here. We also have Ashley Bissett on the line. She may have some insights or experiences that she could share from Edmonton.
We did just get a question from Laura saying that Marianne might know, it seems if we are on an emergency list to help if needed, we must register with AHS. If we are not registered with AHS, how and who would be contacting us if they needed assistance with long-term care? Most are not AHS.
Hi, so it's Alberta Health that actually asked us to compile the emergency roster, and it could be Alberta Health or Alberta Health Services that asks for the contact information on the roster. They haven't approached us yet. We have established the roster, and there's over 125 people on it now, and some of them are private practice, etc. And some are, of course, in HS already. So a variety from across the province, and we're still in holding mode, but I will actually check with our government rep about if there are plans from Alberta Health to enact the roster beyond AHS enacting it.
Thanks, Marianne.
Would anyone be willing to share currently what state they are in perhaps redeployment or not even redeployment at all?
Perhaps just how they're coping in their programs as they are right now?
Yeah.
Hi, it's Charlene here.
Hi, Charlene.
So one of the things that I'm struggling with currently is I don't know whether I'm supposed to hold myself ready for deployment, or really go gung-ho as a private practice OT in upscaling my virtual service, my remote practice service. So it sounds a bit like there's enough OTs on the roster,
Has
even if things
joined.
get worse, that I won't be needed. If anybody has a comment on that, if I got that right.
It's Marianne. I think that will really depend on whether, for example, government is looking at redeploying a large amount of people to long-term care, the private long-term care facilities, as well as the AHS-held long-term care facilities. If so, and if there are a lot of people ill a lot of staff that are ill in the long-term care facilities, I don't know if that's the case yet or not, but it could come to the point where we need more. So we don't really have the numbers needed at this point, and we don't have indication from government yet if they're going to be redeploying to the privately held long-term care facilities. So yeah, it's an unknown, but I will try and get some of those answers and circle back with SAOT and add an e-news once we get some of those answers.
Thanks, Marianne. I think that's a big thing that many OTs are experiencing, is just that uncertainty of what in this moment should I be waiting for, or what in this moment should I be doing? And like Charlene says, with virtual practice, do I go ahead with that? I'm wondering from the community, for folks who are private practice, how are you managing with that transition to virtual practice?
Hey,
That's
Robin,
something.
would it be okay?
There.
Oh,
It's Lindsay
go ahead.
Kaut from SAOT and also private practice. And yeah, I think we just sit on a different spectrum of the uncertainty, piece there. Many of us were waiting to see what the rules were around the Canadian Emergency Response Benefits as well, because some of us were providing services to our clients, but if we made $100, we also cut ourselves out of any government assistance. Now that some of that has changed, we are in a place, and I was lucky enough that I was already in the virtual space to do that. However, people, there's, in my experience, our practice is pretty much none right now. So seeing maybe 3 to 5 people a week. And the other issues too is that many people don't have things like childcare or different things like that. So even trying to put our name on the ACOT list is really hard, not knowing how we would then manage the other pieces in our life, right? And try and make sure that we can manage our financial side, our obligations. And I know that that's everybody across the board, not just private practice, but that's kind of our experience right now is there's lots of announcements, but not lots of details. So it's very hard to make informed decisions.
Mm-hmm.
Thanks for sharing, Lindsay. I think it's really, really tough for us all. And I mean, in the private practice right now, it sounds as though it's a very, very challenging time. Does anybody have any, maybe resources that, or strategies that you've been using to kind of keep your practice going and or afloat at this time?
Rosanna, it's Robin. I'll just make mention too that we have decided that the next call, which will be April 27, will be focused on private practice.
Thanks, Robin. Megan here has written that she's in primary care and virtual care has been very tricky. I'm finding I can't do assessments, but I'm doing a few consult calls to other team members and family physicians. Also doing wellness checks on waitlisted and current clients. Megan, do you find that doing some of this work is trying to manage your caseload, or more just kind of a stopgap while we're dealing with this hold in services at this time?
Hi, it's Megan here. Sorry, I missed the first part of that as I was trying to put my headphones in.
Oh, my question was whether if virtual care has been tricky, which we're finding in our teams as well. Are you finding that, the wellness checks and on the wait listed and current clients, it's helping with kind of managing your wait list and to prioritize and strategize when our services resume? Or is it more kind of just another service that you're providing?
Yeah, it seems to be another service. We focus a lot on kind of more vulnerable populations. So we've done kind of some food referrals and mental health, like connecting them with mental health supports. And then I've taken on kind of some other referrals that I wouldn't normally have time to take on, but are more suited for virtual care. So I did like some sensory consults to a family, and I had a physician who called asking about modifying someone's vehicle for hand controls. So just really kind of all over the map.
Carmen, do you have any comment about that with regards to, virtual care and how it's potentially going to change our practice forever? Moving on.
Yeah, that's exactly what I was thinking. I mean, I cannot pretend to be any kind of expert in terms of what you should do with your private practice right now. For the first question, and primary care, for sure, there's going to be challenges, but I guess one message we're really trying to give within AHS is for OTs to be creative. We are good at being creative. We can adapt. And I think through this time, we have to really think about kind of the future presence of OT online, on social media, and doing virtual platforms. We didn't get to it today, but there was an agenda item on my team meeting about virtual exercise classes, and that we're being asked, is the province, are we going to be providing something online for people with Parkinson's, for people with MS, etc.? So, and I think there's, already some groups that are probably looking into that, but just again, provincially, can we coordinate on something? So I think it's a time to definitely think about those, your typical adult client who is now home with children and might need more of a family approach to what's happening to them and in their lives. And maybe some sort of business generation by doing something sort of free now that will generate, business down the road a little bit might be an option. But and then I guess when I think about assessment, we're starting a working group this week actually to talk about home assessment. So occupational therapy, virtual home assessment, and really to talk about like what would that decision making algorithm look like? How do you decide whether, once you know that a client needs a home assessment, how do you decide what can be done via Zoom or telephone versus cannot be done and needs a face-to-face visit? And then knowing that it might not be the OT seeing that client face-to-face in their home, it might be a nurse going in or a TA or another allied health discipline. And so how can we actually work through our colleagues virtually as well, knowing that we can't always go in, we can't have multiple people going in. If we can prevent it, we should be right now. So yeah, those are my thoughts, more just sort of ideas and prompts, but I think next week's conversation will be interesting as well.
I wanted to comment, this is Robin, here in the Calgary zone, the mental health occupational therapists within the inpatient settings have been chatting what our groups look like. And I thought it would be interesting to share that one of the programs, our day treatment programs, is going to be offering a cognitive behavioral social skills training group for their community members that are already on the list for the CBSST via online mediums. So I'm super curious to see how that goes, but I think that shows just another piece of that creativity of, okay, how are we meeting our needs in the community for the folks that are referred to us, and how can we adapt the way that we maybe provide some of our services. So I personally am eager to hear how that goes, and also what that might look like for other types of group therapy, or I see Megan made a comment about coaching related work via video phone care as well. Megan, do you mean coaching clients or coaching our fellow OTs?
I maybe both. Clients, I think, is where I first started thinking about that, but I also have been kind of trying out making little webinars for my other team members as well. So I just did one on kind of looking at the resources available for home modifications, but that was the only one that I've done so far.
That's awesome.
That sounds super awesome, Megan.
Sorry, Lindsay Kaup here
Yeah.
again. So no longer AHS, but just coming back to, I think it was Armin was chatting about the home assessment via virtual. And just with that working group, Carmen, if you'd like me to send over some names, because when I was working in AHS, we actually were doing that about, it has to be 6-7 years ago now, and using nursing staff to take pictures on reserve where we were not, we did not have permission to go. So that was how Ponoka and Musquecheese actually functioned for almost a full year in terms of wheelchair assessment and home assessment. So yeah, that's kind of the thought there. And there's a ton going on in the virtual world, and that's going to be a further conversation, obviously, around. There's so much happening right now, webinars and free stuff, lots of those different things happening. So it's not a Debbie Downer piece, but at the same time, just trying to make sure that, you know, we're open and well used as occupational therapists, and also what, you know, how far can we go in the virtual space, because there's a lot of the legislation and different things that never addressed this, because it wasn't a big deal when it was made. So I think that that's the really exciting piece, is we're going to see a lot of change, I hope, out of some of this, and updating what does that look like, including occupational therapy in the virtual world, right?
Yeah, really great points. And I'd love to get names from you, absolutely.
There's a question from, sorry if I mispronounce your name, Neelan. I got asked if I work elsewhere at work. It was my impression that we are only to work at one location right now. Is this also for other service providers and sites?
Yes, that is certainly the message that I've been getting, that people are needing to choose one work location. Now, I guess I've heard that from the context of an AHS employee. So we have lots of staff that work at, you know, maybe in home care and outpatient services, or outpatient services and inpatient services. So for those staff, they're having to choose within their FTE, their full-time equivalency position with AHS. They're having to figure out with their manager what one job they will continue, and to not be doing the other location work. Not sure how that translates into if you're working both privately and with the example, but I would imagine the rule would generally still apply.
Carmen, can I
to follow up with her? Go ahead.
Oh, I was just going to ask. So my understanding of that is for OTs that work on one inpatient unit, but also work on a second inpatient unit, maybe at the same site or in a different hospital, that they should be choosing just one.
That's a good question. I've only heard of it from site to site, like going into people's homes and being in a hospital. I don't know, maybe someone else can answer about units within a hospital. That might depend on the facility.
Yeah, this is interesting. It's Rosanna here, and what we've been instructed at this time is some of our OTs that are being called to go to an assessment center, they may get a shift a week, but if we don't have any other shifts, we report back to our office and do our community work. Does that not sound consistent with what Nylene is talking about here? Is that not right, Carmen, that we would have to do either or is it during the semi-redeployment, we would just basically pick up redeployment shifts and then finish the rest of our FTE in our regular work site?
I haven't heard that for sure, so I don't have a certain answer. It's mostly coming from the long-term care facility issues where they're really requiring people to work at one center and not multiple centers. And then in the North Zone is where I heard about the need for them to look at their staffing and people who have FTEs where they're literally split between different program areas. But I'm not sure in your situation, Rosanna. I assume for now, whatever your managers are supporting is where we're at today, but it's changing rapidly and it could become a decision line for people to work either one or the other if they're coming into contact with in both environments.
For sure. Okay, thank you so much, Carmen. Okay, so a few questions that have come up here is that are private practice OTs getting paid for helping for swabbing? I'm not sure. Carmen, maybe you can help me in answering this right now, whether if private practice OTs are being trained for swabbing or have been recruited to help with swabbing at this time.
I would assume they're being paid if they've been hired to do the work, but I don't know of any private practice OTs that are doing swabbing. Is anyone on the line, private practice and coming into a clinic or a community location to do swabbing? Oh, being on the ACOT roster and being asked to come in and help.
Hi, it's
Yeah,
Marianne.
Yeah, go ahead, Marianne.
Yeah, we haven't been asked for the names on the roster yet, but we did send out an info item to people on the roster to register with AHS if they were interested in helping with pandemic efforts. So if people have registered and have been contacted, that I'm not aware of that happening yet, but it could happen.
Thanks, Marianne and Carmen. One of the other questions that has popped up from Laura or comments as well is I do work on reserves via contract group. We're only going out for those who are early discharges from hospital and at risk if I don't. Virtual options are so limited there with few having internet and few with cells that function. I find by expecting the RNs to go out and take pictures, etc., and send, they are already overloaded and tired, as so few accessory providers are going out. Just thinking of how some of this is affecting the few left to deal with everything. That's a really good point.
Yeah. Yeah, really good point. And I think the earlier point about getting nurses to take photos and whatnot, that was in a different work context than it is now in the pandemic, and will change again in the future. But certainly part of the decision making about what's needed and then who the provider is that's going to deliver that. So there's probably for support within those teams to help triage, help take the load off in any way possible of those staff that are doing the front line. So help them out with other tasks like maybe the follow-up phone calls or the pre-visit phone calls so that they're only doing that frontline piece if that's what they need to be doing. So just thinking from that system perspective and collaborating and making sure we share the work as much as possible would be really important. And obviously then just further prioritization, like the key priority in the province is to keep people out of hospital. So we're discharging people rapidly from hospital, sometimes directly from critical care home and other times from acute care home, or not admitting patients to begin with if they can possibly stay out of hospital, just to minimize risk. So we're all going to be experiencing higher levels of acuity, both in acute care and in the community. So having to really reprioritize who gets seen and for what, and knowing that the home assessment, that's why we're working group, is that home assessment is so critical. If the person needs a piece of equipment or practice with mobility or in order to prevent them from falling, for example, then that will help to prevent a hospital admission or readmission.
Mm-hmm.
Carmen, it's Rosanna here. And has there been potentially any talks with regards to moving allied health providers in OTs kind of around Alberta, or do they stay kind of within Edmonton zone or Calgary zone, or are we not at that point yet?
So the ZOCs are the Zone Emergency Response Team. So each zone is working as a zone, and then those ZOC groups report up to the ECC, which is the Provincial Emergency Response Group. The acronyms are a little bit crazy. I didn't even know what they all stood for when it first started. Maybe some of you have heard those terms. So I would say right now it's happening really organizationally. It's at a zone level to deploy and redeploy staff. But we have been told that within unions, for example, or just even as an AHS employee, people can be redeployed anywhere within the organization to any sector, any zone, anywhere. But obviously there's logistics of that would have to be then supported. So I believe for the most part, we will see redeployment happening within the city or town, or at least zone where the person is currently working. But certainly people are being deployed to different locations. Like we've already had staff from a hospital move to an outpatient center to provide that inpatient service at a different location than they normally would. So staff have definitely had to move office and change their commute patterns, etc. But I haven't heard of anything between zones happening.
Thanks, Carmen.
I was going to comment that I'm aware of the time. We're approaching 8 o'clock. And we, as Robin had mentioned earlier, we were going to take a self-compassion break for the last few moments. So right before we do that, are there any last comments or chat questions that we can address or come back to at a later time?
Just Laura's last point there about rapid discharge to rural areas, and therefore clients being at risk once they're home, and it's hard to find resources, including equipment. This won't directly answer, but what we are starting to do, and Rosanna could speak to this as well, is create a vendor list. So right now, I think different hospitals and programs and OTs across the province have been trying to keep track of their own vendor list within their city or town area of what equipment providers are actually still functioning, what vendors are doing drop-offs, whether they're charging or not for delivery, all of that. And so we're trying to file those lists of vendors and where their current status is within COVID, and then keeping that up on the share site so that everybody within the zone would have access to that same information. So just more of a compilation of resources and updated information about equipment vendors.
Mm-hmm. Thanks, Carmen. So Robin Talaski, I will turn it over to you. I think we're going to switch our screens here. This is from some resources online of simple meditations as well as self-compassion, mindfulness activities. We thought that it would be useful to do at this time as we're going through all this uncertainty to take a little moment for ourselves and practice some of the strategies that we are trying to support our own clients and our families and our friends with as well.
Thanks, Robin. Everyone on the call, I'm not clear if the audio will work as well as the video when I share my screen. So if you wouldn't mind, just in the chat box, I just posted the link. So in the event that the audio, for whatever reason, doesn't work when I share my screen, you can access the link there and just play it for yourself on your computer or tablet. So let's give it a go.
Practice is called the self-compassion break. And it's something you can do anytime during the day or at night when you need a little self-compassion. To practice this exercise, we actually need to call it suffering. So I invite you to think about a situation.
It sounds like our audio isn't quite working the way that we are hoping for. So the self-compassion break is the one that we were hoping to play for you all is a 5-minute clip that takes us through identifying what's going on for us in this moment in time, what stressors are coming into our life, and what emotional discomfort we might be holding in our body. So as we're coming close to the end of the hour, what we can do from SAOT, Robin, is just to share the link itself with the group. And I would encourage you all to take a moment if you have 5 minutes towards the end of the night, right before bed, or even during your lunch breaks when you're at work, just to take a moment and just do some introspection and notice what it is in this moment that you're experiencing and how you're coping, and allowing yourself to give yourself a bit of compassion during that time that we are all going through some very weird times together, and that we are all doing the best that we can with what we've got in this moment, and that it's okay to reach out and ask for support and ask for help. So as Robin mentioned, next Monday, April 27th, we will be having another meetup call with the focus being on private practice specifically. So for members that are on the phone call right now that are in private practice, we would really encourage you again to come back, share your thoughts, your concerns, your questions, as well as what observations you've noticed have really worked for you and the strengths in those moments. And just say a quick thank you all for participating. Carmen and Marianne, I don't know if there's anything that you'd like to finish off with, or
just to say thank you for all the frontline work that you all do. These are such challenging times, and like Carmen said, OTs are creative and are rising to the challenge. So thank you.
Yeah, and it's Carmen here. Thank you again for having me. I hope I was able to answer some of the questions, and just wanted to also mention that I'm reflecting on the difference between being internal to AHS and external in private practice, and certainly would be happy to follow up and have any conversations and just look at ways that we can support OTs across the entire province, regardless of your employer, and really just wish everyone the best at this really difficult time. Everyone's dealing with personal life changes as well as professional and career life changes. So thank you to everyone, and I look forward to next week's session.
Carmen and Marianne, we really do appreciate having you both on these calls. I think it's been really helpful to have a collaborative approach to answer some of the questions that we as SAOT may not be able to address immediately. So thank you both for participating. All right. So on that note, thank you everybody for participating tonight. We look forward to April 27th with you again at 7 o'clock. Thanks for joining.
Thanks, Robin, and Robin for facilitating. Take care.
Thank you.